I'd like to acknowledge the traditional owners of the land I'm presenting from today, the Wurundjeri people of the Kulin Nation. So thanks for inviting me to present. I'm very excited about showing you the why we care about social health. Last seminar and today we're hearing some great initiatives to overcome poor social health. Obviously, having good social health has immediate benefits through social contact, but it also has devastating long-term consequences. When I talk about social health, I'm generally talking about three concepts. Social isolation is an objective measure of the number of social contacts people have, how many people they see or talk to every week or month. Social support is a subjective measure of how these social contacts are utilised. Loneliness is a subjective experience, it's an overwhelming sense of inner emptiness. In the past, research has often used these terms interchangeably, or when they talk about loneliness, they may have actually incorporated aspects of social isolation, and similarly, social isolation and social support tend to overlap. What we've been finding though is that it's important to distinguish between these. For example, someone may not have much social contact, but they may feel socially supported by those contacts. So therefore, is it really an issue that they're socially isolated? Similarly, someone may not be socially isolated. They may be socially supported, but they still feel lonely. And this is often termed loneliness in a crowd. So distinguishing between these concepts and then looking at how these concepts are related is really important for future research, and working out which is most important for chronic disease and where we should be intervening. The Australian Institute of Health and Welfare states that loneliness and social isolation are considered significant health and wellbeing issues in Australia because of the impact it has on people's lives. 1 in 4 Australians are currently experiencing an episode of loneliness, and that statistic is from 2019, so before COVID. 1 in 2 Australians feel lonely at least 1 day a week, and 1 in 10 Australians say they lack social support. Poor social health represents a public health hazard equivalent to smoking up to 15 cigarettes a day, being an alcoholic, is more harmful than not exercising and twice as harmful as obesity. This is a basic model of how I think about how social health affects premature mortality. So social health can affect directly chronic disease, but it also influences chronic disease through risk factors. I have one theoretical slide that I would like to talk about, demonstrating 2 models of how social health is linked to chronic disease. First of all, the social causation model talks about how poor social health affects chronic disease. And this is through the stress hypothesis. So not having social contact or being lonely increases your stress. Poor social health directly affects your cardiovascular system and also affects your cognitive reserve. So if you're not engaging in social contacts, then you may not hold on to your cognitive reserve for as long. There's also the health selection model that looks at the relationship in the opposite direction. So saying that a decline in health or functioning then limits or reduces social involvement. So someone that, for instance, is approaching being diagnosed with dementia may think that social involvement is too strenuous and then disengages from social contact. I've got 2 slides to explain a little bit of this further. So as an example, loneliness is considered a danger signal activated in the brain like thirst or pain. It can overstimulate the body's stress response, and that then impairs the immune system's ability to fight infections. At Deakin University, they demonstrated this relationship between social health and chronic disease with fruit flies. They injected fruit flies with gut cancer, and the fruit flies that they put all in one vial, so all in a social environment, had less growth compared to the fruit flies that were put in separate, socially isolated vials. And fruit flies were chosen for this experiment as they are social creatures similar to humans. So we know that social health is directly associated with chronic disease risk factors. People with poor social health are more likely to drink, smoke, be physically inactive, overeat, eat unhealthily, and be overweight, as well as have higher blood pressure. And poor social health has been linked to chronic disease through several systematic reviews. We know that loneliness can lead to depression and is also associated with anger, worthlessness, resentment, pessimism, and suicidal thoughts. Poor social health is associated with increased cardiovascular disease. A systematic review has shown that poor social health is associated with a 30% increased incidence of coronary heart disease and stroke. Through 4 systematic reviews, we know that poor social health is associated with lower cognitive well-being and 64% greater risk of dementia. So I'm just going to spend the last couple of minutes of my talk discussing other costs of poor social health. So I've talked about the health costs, but it also has an economic cost. Poor social health is associated with an increased use of healthcare services. That's more general practitioner visits, more medication use, accident and emergency service use, hospital stays, outpatient appointments, and nursing home admissions. Now, this isn't surprising because, as I've been showing you in my talk, someone with poor social health has an increased incidence of disease. But secondly, it's been shown that people with poor social health are looking for interpersonal stimulation, and they see the healthcare system as an avenue for this. So people with poor social health are more likely to seek medical assistance to satisfy their need for interaction and interpersonal stimulation. And that's even after accounting for their physical health, age, gender, and socioeconomic status. So taking into account the fact that they may have worse ill health. Poor social health also has a burden for employers through increased costs. It's been estimated that in Australia, every year, $1.7 billion is lost through absenteeism, caring, lost productivity, and high employee turnover due to poor social health. Poor social health is also associated with reduced quality of life. Now, this is not surprising because for many, social relationships are considered a key dimension of quality of life. So thank you for listening, and any questions?